Good morning, good afternoon, good evening, wherever you are. It's my pleasure to be hosting Dr. Ali Aminian, one of the most important and active members of the Communication Committee, a surgeon in Cleveland Clinic, and a major contributor to the bariatric surgery world. And his one of the most important contributions recently was the article that you published in JAMA. So welcome, Ali.
Thank you, Ahmed. Thanks, Dr. Bashir, for a kind introduction. Happy to be here.
So how did the idea of this study form?
So basically, we know that bariatric surgery is associated with significant improvement in diabetes and cause significant weight loss. But we didn't know if these procedures cause significant reduction in cardiovascular morbidity and mortality. And the fact is that in patients with obesity and type 2 diabetes, cardiovascular morbidity and mortality are the major health problem. So that's why we decided to do this study to see if a weight loss procedure can improve cardiovascular health. That was the main reason that we did this study.
And it's such a great, well-designed study. What would be the take-home message from this study to the medical community?
So this is a matched cohort study, and we followed almost 14,000 patients for 8 years after enrollment into the study. And following for 8 years of these patients showed that bariatric surgery, metabolic surgery, was associated with a striking almost 40% reduction in risk of adverse major cardiovascular events, particularly the risk of dying, the risk of mortality significantly dropped by 41%. That means if we do these procedures on 13 patients, we can save one life. That's a striking and impressive findings, and we did not expect such huge effect size with these interventions. So the take-home message for medical community would be that cardiologists, endocrinologists, primary care physicians, general practitioners should consider bariatric surgery, metabolic surgery as a tool when they see their patients with obesity and type 2 diabetes, and they should consider that they should start this conversation about benefits of these procedures with their patient, and hopefully they can refer more patients to for consideration of bariatric surgery. I think that would be the main take-home message from this study.
And it's such a surprising finding. What was the let's say the perception of the medical community in Cleveland Clinic once that study was done?
So as I mentioned, the findings were impressive, very striking. Even we as bariatric surgeons on the surgery side of the study did not expect such huge effect size. So 40% reduction in major cardiovascular events was huge. So with any medical intervention, different type of medication that cardiologists use to treat heart disease, to control blood pressure, to modify risk factors with the statins, all these medications, they usually see 10, 15, 20% reduction in risk of these adverse events, and they usually don't see significant change in the mortality risk. But this huge effect size was surprising for all of us, including the people on the medical side of the study.
Great, thank you, Ali. Looking forward to the Journal Club next week. Join us for this to talk about the details of this important article and work. And thank you for your major contributions, Ali. Looking forward to next week.
Thank you. Appreciate you and the IFSO for the opportunity.
Thank you.
See you. Thanks.
See you next week.